Hi, good morning, Liam. My name is Mihira. I'm your invigilator for the OET-speaking session on the 6th of August 2023. How are you doing?
Hi, good morning. I'm good. Thank you for asking. How about you?
Well, I'm great. Can you tell me your full name for the record, please?
My full name is Liam Hales.
And what is your candidate number, please?
My candidate number is 2360236.
Thank you. Are you taking this test as a doctor?
Yes, I am.
All right. Can I see your ID, please?
Sure. Here it is.
Okay. Now, let's move on to warm-up sessions. The warm-up questions are not assessed, and are a chance for us to get used to each other's voices. We'll just talk for 2 to 3 minutes.
All right, Mihira.
Why did you choose to become a doctor as your career path?
I chose to become a doctor because I have always been fascinated by the human body and how it works. I also enjoy helping people and making a positive difference in their lives. Being a doctor allows me to combine my passion for science and medicine with my compassion and empathy for others.
What is the best medical success story of your career so far?
One of the best medical success stories of my career was when I was able to save a young boy who had a severe allergic reaction to a bee sting. He was brought to the emergency room with anaphylactic shock and was barely breathing. I quickly administered epinephrine and steroids and monitored his vital signs until he stabilized. He recovered fully and was discharged the next day. It was a very rewarding experience to see him smile and hug his parents.
How do you inform or educate patients and their families about challenging news?
I always try to inform or educate patients and their families about challenging news in a clear, honest, and respectful manner. I use simple and non-technical language and avoid jargon or euphemisms. I also provide them with relevant information, such as the diagnosis, prognosis, treatment options, risks, benefits, and alternatives. I listen to their concerns and questions and answer them as best as I can. I also offer them emotional support and empathy and refer them to other resources if needed.
How do you remain up to date about new medical updates, practices, or tools?
I remain up to date about new medical updates, practices, or tools by reading journals, attending conferences, taking courses, and participating in online forums. I also consult with my colleagues and mentors and seek feedback on my performance. I am always eager to learn new things and improve my skills as a doctor.
How do you deal with conflict between yourself and another member of the medical team?
I deal with conflict between myself and another member of the medical team by communicating openly and respectfully and trying to understand their perspective. I avoid personal attacks or criticism and focus on the issue at hand. I also try to find a common ground and compromise and respect their opinions and decisions. If the conflict cannot be resolved by ourselves, I seek the help of a mediator or supervisor.
Great. Thank you very much for sharing that. So, let's move on to role play now. I'll take the part of the patient, or perhaps a relative, and you'll take your professional role. The purpose of the role play is to get evidence of your ability to communicate effectively with patients. Use your ability to fulfill as much of the role play as possible. Do you have any questions?
No, Mihira.
You have up to 3 minutes to prepare the role play. You will start the role play after that time. I'll let you know when the 3 minutes are up. You can ask me if there is anything you are not sure about, and you can make notes on the role play card if you want to. Here's a pencil for making notes.
Thank you, Mihira.
You can look at the card during the test, but you must return it to me at the end of the test. Please start preparing now. Thank you. Your preparation time is over. You can now start your OET-speaking roleplay. Don't worry if I stop you when the time is up.
Good morning. I am Dr. Liam Hales. How may I address you?
Good morning, Dr. Charles. My name is Mihira.
Good to see you, Mihira. How may I help you today?
Thank you for seeing me today, doctor. I wanted to discuss my prescription for sleeping pills.
Of course, I'm here to help. How often have you been taking sleeping pills?
Well, doctor, I've been taking them every night, as prescribed. I must admit, they have been quite effective. You see, my job as a financial advisor is exceptionally demanding, and the constant overseas travel adds another layer of stress. The pills have been a sort of lifeline, helping me feel more relaxed and capable of coping with the challenges.
I appreciate your sharing that with me. It's important to address the stress you're under. However, I want to emphasize that using sleeping pills as a long-term solution is not recommended. Mihira, it is correct that they provide temporary relief, but don't address the root cause of the sleep problem. Furthermore, there's a risk of developing a dependency on them.
I understand your concern, doctor. But my work schedule remains intense, and I'm afraid of losing my ability to manage without the pills. Is there any way I could obtain another prescription? I'm running out, and the thought of not having them is causing me more anxiety.
I empathize with your situation, but my main focus is your overall well-being. While the pills may offer short-term benefits, I'd like to explore non-medical interventions that can provide more sustainable results. Mihira, engaging in regular physical activity, finding ways to manage your workload effectively, and reducing your alcohol and caffeine intake are all measures that could significantly contribute to improving your sleep and managing stress.
I appreciate your suggestion, doctor. However, these pills have been remarkably effective for me. I'm concerned about abruptly stopping them and facing potential withdrawal symptoms. I promise that, once my work commitments ease up, I'll be more open to trying out those other strategies. Right now, I genuinely need something that can help me stay functional.
I understand your hesitation, and I'm here to guide you through this process. It's important to remember that we can work together to gradually reduce your reliance on the pills while incorporating these non-medical approaches. Mihira, this way, we can address your anxiety and sleep concerns while minimizing the risks associated with prolonged use of medication.
You have a point, doctor. It's just challenging to envision managing without the pills at this point. But I trust your expertise and advice. I'm willing to give those alternative strategies a shot.
I'm glad to hear that, and I want to assure you that I'll be with you every step of the way. Well, Mihira, before concluding, let me summarize what we have discussed so far. You, being a financial advisor, facing job-related stress and sleep difficulties, discusses your prescription for sleeping pills. You share that the pills have been effective in helping to cope with the demanding work and overseas travel. However, I expressed concern about the long-term use of sleeping pills, emphasizing the need to address the root cause of the sleep problem and the risk of dependency.
Yes.
But you were worried about managing without the pills and the potential withdrawal symptoms. I suggest exploring non-medical interventions, such as regular physical activity, effective workload management, and reducing alcohol and caffeine intake to provide more sustainable results. And you promise to consider these strategies in the future, but expresses your immediate need for something to help to stay functional.
Exactly.
Then I acknowledge your concerns and propose a gradual reduction of reliance on the pills while incorporating non-medical approaches to address anxiety and sleep issues. And you agreed to give the alternative strategies a try.
Yes, it is correct.
Mihira, if you have any questions or encounter difficulties as you implement these changes, please don't hesitate to reach out. Your health and well-being are my top priorities.
Thank you, Doctor. Your understanding and guidance mean a lot to me. I'm committed to following your recommendations and making positive adjustments.
You're very welcome, Mihira. Remember, we're partners in your health journey. Take care, and don't hesitate to contact me if you need any assistance or have any concerns.
Thank you, Doctor. That is the end of your OET-speaking roleplay. All the best.
Thank you.
Thank you for watching. Please, like this video and encourage us.
Subscribe and stay tuned for more videos. Kindly comment your suggestions and help us do better.